Which of the following agents is not used to treat angina symptoms? Options are propranolol, nitroglycerin, ranolazine, digoxin, verapamil. Here the answer is option D, that is digoxin. Digoxin is a cardiac glycoside. Digoxin would worsen angina symptoms by increasing cardiac contractility and thereby increasing myocardial oxygen demand. Spontaneous depolarization of the SA node can be reduced by options are verapamil, lidocaine, milrinone, digoxin, flecainide. Correct answer is option A, that is verapamil, which is a calcium channel blocker. SA nodal cells are highly dependent on L-type calcium channels for their spontaneous depolarization and initiation of pacemaker activity. This allows verapamil to have a significant bradycardia effect by blocking these channel activities. The relative specificity of lidocaine and flecainide for sodium channels prevents them from having significant effects at the SA node. Milrinone tends to increase heart rate by increasing intracellular cyclic AMP to enhance spontaneous depolarization of the SA node, whereas digoxin has greater effects on the AV node via vagal inputs. Which of the following is a likely adverse event of heparin therapy? Options are purple toe syndrome, thrombocytopenia, dry cough, skin necrosis, hypertension. Answer is option E, that is hypertension. All the adverse events listed except for hypertension have been reported with heparin use. However, heparin needs to be used cautiously in uncontrolled hypertension in order to prevent the occurrence of strokes. A major use of dabigatran is in options are thrombocytopenia, stroke prophylaxis in atrial fibrillation, decreasing clotting after stent placement, breaking down clots that have formed during myocardial infarction, intermittent claudication. Here the correct answer is option B, that is stroke prophylaxis in atrial fibrillation. By virtue of its direct inhibition of thrombin, not requiring antithrombin 3, dabigatran is able to reduce the clot formation in patients with atrial fibrillation. It is not approved for decreasing clots after stent placement or in intermittent claudication. Bile acid reabsorption from the gastrointestinal tract is reduced by options are acetamide, cholestyramine, pravastatin, niacin, fenofibrate. Answer is option B, that is cholestyramine. Only the bile acid binding resins such as cholestyramine reduce the reabsorption of bile acid from the GI tract to reduce plasma LDL cholesterol levels.